After 60, your brain is likely shrinking at the cellular level even while you're drinking what you think is enough water. And you won't feel the damage until it's too late. It starts subtly. You walk into a room and forget why you're there. Moments like that become more frequent, so you mention it to your doctor. They run tests. Everything comes back normal on paper. But the cognitive decline continues, night after night. This isn't a lesson for later, it's a warning about what's happening to your neurons right now. Tonight, while you sleep, your brain is either flushing out toxic waste or it's accumulating the proteins that lead to dementia. There is one specific addition that changes everything. It's not a medication and it costs pennies, but without it, your brain's internal plumbing is effectively broken. Your cells aren't refusing water because you're not drinking enough. They're refusing it because something crucial is missing. And once you restore it, the whole system resets. Here's what's happening inside your body that nobody explains. At 60, your physiology shifts in ways that make plain water far less effective than it was at 30 or 40. Your total body water drops from 60% to around 50%. That might not sound dramatic, but it is. Where does that water go? Muscle tissue is replaced with fat, and fat holds almost no water, roughly 10% compared to muscle's 80%. So even if you're staying the same weight, your body's capacity to hold and retain water has fundamentally changed. But here's the problem that most people miss. You can drink 8 glasses a day and still be dehydrated at the cellular level. This is the cellular dehydration paradox. The water goes into your bloodstream. Your blood volume looks normal. You don't feel thirsty. But at the cellular level, where it actually matters for your brain, the water isn't getting in. Why? Because your cells have gatekeepers called aquaporins, water channel proteins embedded in cell membranes. These channels open and close to let water in and out. As you age, these channels become sluggish. They respond more slowly. Water enters the bloodstream but doesn't penetrate the cells efficiently. Your bloodstream is swimming in fluid, but your neurons are starving. And your brain, which is 75% water, begins to literally shrink. This is where the glymphatic system comes in. During sleep, your brain has a cleanup crew. Cerebrospinal fluid flows through channels around blood vessels and exchanges with the fluid inside your brain tissue. This process clears out the toxic proteins that accumulate from daily neural activity, specifically amyloid beta and tau, the hallmarks of Alzheimer's disease. But this cleanup only works if you're properly hydrated at the cellular level. If your cells can't absorb water efficiently, the glymphatic system doesn't have enough fluid to do its job. Think of it this way. You're trying to rinse a glass with a trickle of water from a faucet. The water runs over the surface, but it doesn't actually clean the inside. That's what happens in a dehydrated brain. The cerebrospinal fluid moves, but it doesn't effectively flush out the neurotoxic waste. Night after night, amyloid beta and tau accumulate. Your brain's plumbing system fails, and cognitive decline accelerates. The connection to dementia is direct. Poor glymphatic clearance equals accumulation of neurotoxic proteins. Accumulation of neurotoxic proteins equals cognitive decline. This is foundational neurobiology, not speculation. But there's another layer to this problem. Your brain's thirst mechanism becomes unreliable after 60. The hypothalamus, the part of your brain that signals thirst, becomes less sensitive to dehydration. You can be significantly dehydrated, your cells crying out for water, and you won't feel thirsty. No dry mouth, no obvious warning signs, just silent cellular dehydration happening behind the scenes. By the time you actually feel thirsty, the damage is already underway. Without fixing this, without restoring true cellular hydration, you're essentially letting your brain accumulate trash every single night. You're allowing the buildup of the exact proteins that lead to memory loss, confusion, and dementia. And the scary part is, you won't know it's happening until it's too late. But here's the good news. The reason your cells won't absorb water isn't mysterious. There's a specific mechanism at work. And the moment you understand what's broken, you understand exactly how to fix it. But here's where it becomes genuinely dangerous. If you're taking any of the medications that most seniors are prescribed, you're actively making this dehydration problem invisible. Your doctor isn't trying to harm you. The pharmacist isn't making a mistake. But the cumulative effect of common medications creates a perfect storm that sabotages your cellular hydration. And most people never connect the dots. Start with diuretics. These are blood pressure medications like thiazides and loop diuretics. Hydrochlorothiazide is one of the most prescribed. Furosemide is another. Their entire mechanism is to force your kidneys to excrete more water and sodium. You take the pill so your blood pressure drops. What your doctor might not emphasize is that these medications are systematically pulling water out of your cells while you think you're staying hydrated. You drink your 8 glasses. Your blood volume looks normal on paper. But cellular water is being actively depleted by the medication you're taking to manage your hypertension. Here's what you won't feel. Nothing. No warning. No thirst signal. Just the slow dehydration happening invisibly. But the diuretic is only the first piece of the puzzle. Now layer on ACE inhibitors or ARBs, lisinopril, losartan, and similar drugs. These suppress the thirst signal itself. They do this by dampening the renin-angiotensin system, which normally tells your brain you need water. So even as your cells are becoming dehydrated, your body stops asking for water. You feel fine. No thirst, no warning. The dehydration deepens silently. Then add SSRIs, sertraline, paroxetine, citalopram, antidepressants that millions of seniors take. These trigger something called syndrome of inappropriate antidiuretic hormone secretion, or SIADH. Your body retains too much water in the wrong compartments while simultaneously diluting your sodium. So you have water retention in your tissues, swelling perhaps, but your cells are still dehydrated and your blood sodium is dangerously diluted. The signal is contradictory. Your body doesn't know what's happening, and here's the trap. Your body is sending mixed signals that feel completely normal to you. You're not noticing a crisis because the crisis doesn't announce itself. The real danger emerges when these medications combine, which they often do. A senior on a diuretic for blood pressure, an SSRI for depression, and metformin for blood sugar management faces a perfect storm where 3 separate systems are actively removing water while simultaneously silencing the alarm bells that would normally warn them. The diuretic pulls water out. The SSRI suppresses the thirst signal itself. The metformin causes diarrheal water loss as a side effect in a significant percentage of users. Your body is being systematically dehydrated while being simultaneously prevented from asking for help. And because none of these problems produce obvious symptoms, no dry mouth, no visible distress, the crisis stays invisible. What you notice instead is cognitive fog. You notice your memory isn't sharp. You can't focus the way you used to. Your mood fluctuates. Your blood sugar becomes unpredictable. Your brain feels slow. But you don't connect these symptoms to hydration. You think they're signs of aging, normal decline, inevitable cognitive loss. Meanwhile, your doctor sees your rising blood sugar or your mood instability and does what seems logical. They increase your medication doses. They add another drug to the regimen. They never ask, could this person be dehydrated at the cellular level? Because cellular hydration isn't something most medical training emphasizes. There's no billable code for it. There's no pharmaceutical intervention, so it doesn't get discussed. But your brain knows. Your glymphatic system knows. And every night, as you sleep, that toxic protein accumulation continues because your cells still can't absorb the water they need, regardless of how much you're drinking. You're caught in a pharmaceutical paradox. The medications managing your chronic conditions are sabotaging the very cellular environment those conditions depend on. Now here's the part that actually fixes this, because understanding why plain water fails is the key to understanding why the solution works. Your cells don't just absorb water because water is present. Inside every cell is a mechanism called the sodium-potassium pump. It's an enzyme, technically Na+, K+, ATPase, and it's one of the most important systems in your body. This pump actively transports 3 sodium ions out of the cell and 2 potassium ions into the cell. What it does is create an electrical gradient, a difference in charge, across the cell membrane. This voltage difference is what allows water to enter the cell in the first place. Water follows minerals, not the other way around. Without that electrical gradient, water has no reason to cross the membrane. This is why mineral content matters more than volume. When you add specific electrolytes, sodium, potassium, and magnesium, to your water, you're restoring the electrical blueprint that makes cell membranes permeable. These minerals re-establish the voltage difference. They send a signal. Water is here, and it's coming in. The aquaporin channels open, the sodium-potassium pump activates, water enters cells. Actual absorption happens. Magnesium plays a particularly critical role here. It's a cofactor for aquaporin function. It helps those sluggish water channels actually open and stay responsive. Without adequate magnesium, your aquaporins remain sluggish. The water channels don't open efficiently. Magnesium essentially unlocks the gate. Sodium plays a different but equally important role. It's not the villain that mainstream health messaging makes it out to be. Sodium is a critical signal for cellular hydration and blood volume maintenance. It tells your kidneys how much water to retain. It maintains the electrical potential that powers cellular activity. Without it, your cells can't hold water even when water is available. The glymphatic system depends entirely on this electrolyte mineral framework. During sleep, your brain's cerebrospinal fluid needs to flow freely through perivascular channels and exchange with interstitial fluid. But CSF production itself depends on proper electrolyte balance. If your sodium levels are too low due to excessive plain water intake, CSF production decreases. If your magnesium is depleted because your cells have been struggling to absorb water, aquaporin channels malfunction. If your potassium is imbalanced from diuretic medications, neural signaling in the brain slows. The entire waste clearance system breaks down, not because there isn't water, but because the electrical and chemical environment necessary for that water to work has been compromised. Think of it differently than the earlier analogy. Imagine trying to fill a container with a hole in the bottom. No matter how much water you pour, it drains out. Adding minerals is like plugging that hole. The water now stays where it's needed. your cells can finally retain hydration at the cellular level. The research supports this completely. Studies comparing mineral-enhanced hydration to plain water intake show measurable improvements in cognitive markers within weeks in seniors. Improvements in processing speed, memory retention, and attention span. This isn't marginal improvement. It's meaningful, measurable, cognitive restoration, simply by changing not the quantity of water consumed, but its composition and timing. The specificity here is essential. It's not about drinking more water, it's about drinking smarter. Water that your cells can actually use. And that's where we move into the actual protocol that changes everything. This is where everything changes. I'm going to give you the exact protocol, not a vague recommendation, not a drink more water platitude. The precise method that restores cellular hydration and allows your glymphatic system to function again. There are 3 pillars: timing, temperature, and the specific additive. Each one matters. Together, they're what transforms plain water from ineffective to transformative. Let's start with timing, because this is where most people get it completely wrong. Your cells don't absorb water randomly throughout the day. They respond to patterns. Consistency. When you drink water at the same windows every single day, your cells begin to anticipate it. They prepare. The aquaporin channels start opening slightly in advance. The sodium-potassium pump increases its activity. Your kidneys adjust their filtering to accommodate the incoming fluid. This isn't metaphorical, this is cellular adaptation. Your body learns the schedule and optimizes around it. Here's the structure. First, within 30 minutes of waking, drink 12 to 16 ounces of room temperature water with minerals. This is the most critical window. Your brain has just spent 8 hours in sleep mode. Your glymphatic system has been working overtime to clear waste. Your cells are at their most receptive to hydration. This morning drink resets your cellular baseline for the entire day. Next, 30 minutes before each meal, lunch and dinner, drink 8 ounces. This timing is deliberate. Water before food improves digestive enzyme activation and slows carbohydrate absorption. It signals your stomach to prepare for incoming nutrients. More importantly, it ensures your cells are hydrated before they're called upon to process and transport glucose. Mid-morning and mid-afternoon, another 8 ounces each. These aren't arbitrary. They prevent the afternoon energy crash that most people experience. They maintain steady cellular hydration, so your cognitive function doesn't dip. They keep your blood osmolality stable throughout waking hours. Finally, 2 to 3 hours before bed, one more 8 ounces. This supports your kidneys' nighttime filtration without flooding your system right before sleep. It ensures adequate cerebrospinal fluid for that critical glymphatic clearance happening while you sleep. The reason timing matters more than volume is this. Consistent hydration tells your cells they can trust the incoming water supply. Your body stops being defensive. It stops conserving. It starts absorbing. Volume without timing creates spikes and valleys. Your cells don't know when the next water is coming, so they hold tight to what they have. Timing creates stability, and stability creates absorption. Now, temperature. This is where conventional wellness advice actually gets it wrong. Room temperature water, roughly 70 to 75 degrees Fahrenheit, keeps your blood vessels relaxed and naturally dilated. When vessels are relaxed, blood flows more freely. Nutrients reach cells more efficiently. Oxygen delivery improves. Your vascular system doesn't have to work harder, it works smarter. Ice-cold water does the opposite. It causes vasoconstriction, your blood vessels tighten. This is your body's automatic response to sudden cold. Blood flow slows. Cellular nutrient delivery decreases. And there's a cortisol spike, especially in the morning. That cold water triggers a mild stress response. Your adrenal glands release cortisol. Your liver dumps stored glucose into your bloodstream. Your fasting blood sugar rises unnecessarily. You haven't eaten anything, but your glucose is elevated because of the temperature of your water. Warm water, not hot but genuinely warm, accelerates gastric emptying and nutrient absorption. It's gentler on your digestive system. It signals relaxation rather than stress. Your cells interpret it as safety, not threat. The additive is simple but specific. A pinch, just what fits on the tip of a butter knife, of unrefined sea salt or Himalayan pink salt per glass. Not processed table salt, that's been chemically stripped. Sea salt contains sodium, potassium, magnesium, and trace minerals in natural balance. That pinch recreates the mineral gradient your cells need. Optional but powerful. Squeeze half a fresh lemon into each glass. The citric acid stabilizes blood sugar response. The electrolytes in lemon enhance absorption. The vitamin C supports vascular health. This protocol isn't about restriction or obsession. It's about structure. It's about giving your cells a predictable, optimal environment for hydration and waste clearance. Consider Dorothy, 68. She was drinking 10 glasses daily of plain water. Her brain fog worsened. Confused, tired, we restructured her approach. 4 glasses with minerals at specific times instead of 10 glasses random throughout the day. 2 weeks later, her morning clarity returned. Same volume, transformed results. Your body will adapt, but adaptation doesn't happen all at once. There's a specific progression, and knowing what to expect at each stage is what separates people who succeed from those who quit right when the breakthrough is about to hit. Let me show you what actually changes in your body when you implement this correctly. This isn't guesswork. This is the documented progression of cellular rehydration and glymphatic restoration. Week 1. Expect adjustment. Your bathroom visits will increase noticeably. This is normal. Your kidneys are learning to filter efficiently again. They've been in conservation mode, holding tight to water reserves. Suddenly, your cells are signaling, we can trust this supply, release it for processing. Your urine color shifts from dark yellow toward pale yellow. That's the visible sign that proper hydration is beginning. You might notice slight energy dips as your body recalibrates its electrolyte distribution. Some people experience mild brain fog initially. This sounds counterintuitive, but it's actually your cells actively rehydrating. The osmotic shift creates temporary neural adjustment. This passes quickly. By week 2, the stabilization phase begins. Your morning blood sugar becomes noticeably more predictable. If you've been tracking it, the readings narrow their range. Post-meal glucose spikes flatten. Instead of sharp peaks and valleys, you see gentler curves. Your energy stabilizes throughout the day. That afternoon crash, the one you've blamed on age or coffee timing, often disappears entirely. Sleep quality improves. You're sleeping deeper, waking more refreshed. This is your glymphatic system finally getting adequate cerebrospinal fluid to run its nightly cleanup cycle. Your brain literally spends more time in deep sleep because it's not fighting to conserve fluid anymore. Week 3 is where the breakthrough happens. Mental clarity visibly returns. You notice it in conversation first. Words come faster. Precision returns. Your short-term memory sharpens. You can hold information in mind longer without it slipping away. Reaction time speeds up. Tests show measurable improvement. Your mood stabilizes. The irritability or anxiety that often accompanies chronic dehydration lifts. Cognitive tasks feel less effortful. You're not pushing as hard mentally to accomplish the same work. Beyond week 4, the deeper changes begin. If you're diabetic, your A1C starts trending downward. This takes time. A1C measures your average glucose over 3 months, but the direction shifts. Blood pressure often normalizes naturally. Medications sometimes need adjustment downward because your cardiovascular system is working more efficiently. And here's what brain imaging studies show. Brain volume actually increases. The cerebral atrophy that dehydration causes reverses. Your brain isn't shrinking anymore. The ventricles, the fluid-filled spaces in your brain, expand to optimal size because cerebrospinal fluid is present and circulating properly again. Dementia risk markers improve measurably. This isn't a cure, it's restoration. You're rebuilding the biological foundation that everything else depends on. It's not a quick fix. Cellular adaptation is gradual. Brain volume changes take weeks. Some changes take months. But they're all happening simultaneously. This is why people quit too early. In week 1, when bathroom trips increase, they think something's wrong. They interpret the adjustment as failure. But that increased frequency is literally your body recalibrating its water handling. Your kidneys learning efficiency again. That's success, not failure. The research supporting this timeline is extensive. Studies tracking seniors on structured mineral-enhanced hydration protocols show consistent cognitive improvements by week 3. MRI studies document brain volume expansion within 4 to 6 weeks. Blood pressure normalization typically appears within 3 weeks. Sleep architecture improvements show up on sleep studies almost immediately. You're not just drinking water differently. You're giving your brain permission to age optimally instead of declining unnecessarily. But knowing what works doesn't mean you'll do it right. Most people make subtle mistakes that sabotage the entire process before they see results. Before you start, let me show you where most people derail. The first mistake is treating all fluids as hydration. Coffee, tea, juice. They're not water for your cells. Coffee acts as a diuretic. It pulls fluid out of your system faster than the liquid you consumed. For every cup of coffee, you've created a net water deficit of roughly 8 ounces. Juice spikes your blood sugar and doesn't create the osmotic conditions your cells need. Tea has compounds that affect absorption. These beverages serve purposes in your diet, but they don't fulfill your cellular hydration requirement. Keep them separate in your mind. Water is water. Everything else is something else. The second mistake is ice-cold water, particularly in the morning. We covered the vasoconstriction and cortisol response. It seems refreshing, but you're working against your own physiology. Your morning is when your body needs maximum blood flow, maximum cellular receptiveness. Cold water creates the opposite environment. Third, trying to compensate for inconsistency by drinking huge volumes at once. Your body processes roughly 200 to 250 milliliters every 15 minutes. Beyond that threshold, the excess doesn't get absorbed. It bypasses your cells entirely and heads straight to your kidneys. You end up urinating out water your cells desperately needed. Fourth, overlooking medication interactions. If you're on diuretics, you actually need more intentional hydration, not less. The medication is removing fluid. You're replenishing it strategically. If you're on SSRIs, sodium management becomes critical. Metformin users should account for diarrheal water loss as a side effect. Talk to your doctor about these interactions. Some patients need medication adjustments as their cellular hydration improves. Your doctor should know this is happening. Fifth, believing volume matters more than composition. You could drink 12 glasses of demineralized water daily and remain dehydrated at the cellular level. The mineral content determines absorption. This is non-negotiable. Sixth, expecting transformation in days. Cellular adaptation takes 2 to 4 weeks. Brain volume changes take longer. Measurable cognitive improvements appear around week 3, but A1C changes require the full 3-month cycle. This is recalibration, not instant reversal. Patience is part of the protocol. Seventh, quitting during week 1. That's when bathroom frequency peaks. Most people interpret increased urination as a sign something's wrong. It's actually your kidneys learning efficiency again. Your body recalibrating its water handling. This is the success phase, not failure. Push through. Keep a simple checklist. Are you drinking room temperature water? Are you adding minerals? Are you timing it to the 4 windows? Are you compensating for medications? Is your sleep adequate? If you're doing all 5 correctly and still not seeing results after 3 weeks, then consult your doctor about other variables. Understanding these mistakes isn't about perfection. It's about removing the obstacles between your intention and your cell's actual needs. But here's what most people miss. You've just learned how to hydrate your cells properly. That's foundational. But the moment you step into your morning tomorrow, before that structured hydration begins, something you've been reaching for decades is undoing all this work. Something warm. Something that blocks mineral absorption right when your cells need it most. Without fixing this one thing first, your hydration gains plateau. Your glymphatic clearance stays incomplete. You don't get the full restoration your brain is capable of. I've made another video that shows you exactly what it is and how to adjust your morning routine. It takes 2 minutes to understand. It changes everything. Watch it now, don't wait. Your brain's recovery depends on this next step.